Hi, hello everyone and welcome. This is Mandy Paradise with the Office of System and School Improvement. I'm the Prevention Intervention Services Program Supervisor here at OSPI. And it is our pleasure today to host our webinar, Vapes, JUULs, Spuds, and Shots, Prevention and Interventions with Youth. We're just gonna take one moment here to advance our slides. Today's webinar offers a brief exploration into the most common substances used and abused by today's youth. Content focuses on understanding what vaping is, the appeal for youth, and what research says about both the risks and the unknowns of using. Our webinar will last for 1 hour and 30 minutes, and we are recording it. The archived recorded version will be made available on the OSPI website. For those who have registered, a link will also be sent to you once the recording is posted. Additionally, after today's webinar, you will receive an email with a quick survey. Please tell us about your webinar experience, and we're also going to send a separate email with some documents from today, including the slides, healthy use survey data, and an infographic issued by the CDC or the Center for Disease Control. So today's webinar topic was chosen due to high demand from folks in the field of education. This topic has been requested by teachers, student assistance professionals, school counselors, and other educators, and we're so thankful to offer this resource. We also suggest watching our recorded GATE webinar titled Students Who Smoke or Vape, a Red Flag for Supports. That information will be made available to you in our follow-up email. Not only is vaping a topic of interest among our professional colleagues, it's also a topic of concern for adolescent health in Washington State. Our 2018 Healthy Use Survey data tells us that the vaping epidemic has reversed decades of progress reducing youth nicotine use, and we have failed to prevent a new generation of nicotine use. The good news is that the percentage of teens reporting cigarette smoking in 2018 is less than half of what it was a decade ago in 2008. The bad news is that e-cigarettes and vapor product use increased significantly between 2016 and 2018. We also know from our healthy use survey data that youth do not perceive vapor products as risky for their health. And they find that vapor products are really accessible. We know that 68% of 10th graders reported borrowing their vapor products, asking someone to purchase them, or getting them from a family member. Today's webinar has 3 objectives. We want to be able to follow us through the following, which are differentiating among various nicotine and cannabis vapor paraphernalia, analyzing health issues unique to vaping devices based on published research, and discussing trends in vapor product use in Washington State. We are pleased to have 2 Washington State content experts as our webinar presenters today. We have Liz.wilhelm and Arti Shah. Liz.wilhelm coordinates the Prevention Works in Seattle's WINS Coalition, a drug-free communities federal grant through Seattle Children's Adolescent Medicine. Liz has been working in the substance abuse prevention and community health field for over 25 years in a variety of settings, including nonprofits, state government, colleges, hospitals, and local health jurisdictions. Over the years, Liz has managed 5 different federal community-based prevention grants. Liz taught and trained prevention science courses and seminars for over 13 years, including for the UW, Seattle Central College, Bellevue College, Western Washington University, and Tacoma Community College. Liz has lived in Seattle for 23 years, grew up in the Chicago suburbs, and graduated from Northwestern University in Evanston, Illinois. Arti Shah is the Public Health and Education Director at the Washington Poison Center. Arti provides public health direction and leadership for the Public Health Education Program. Arti received her master's in public health from Emory University and is certified as a community health education specialist. Prior to her master's, Arti served as a community health and economic development advisor in Peace Corps, Lesbo, and received her BS in exercise science geared towards public health. So big welcome and big thank you to our presenters today. This is where I'm going to be passing the mic over to our presenters. So let's do a sound check. Arti and Liz, are you live with us right now?
This is Liz. I'm live.
Thank you. Liz, Tell me when to advance the slides.
Wonderful. And can we hear Arti?
Not quite. I'll work on getting Arti live.
Try now. I just unmuted it.
Arti?
Hello?
There we are. Okay, thanks so much.
Oh, wonderful. Okay. I was wondering what was happening.
It was us. All right, should I advance the first slide?
Yes, let's do that. Wonderful. Okay, well, this is Liz, and I'll go ahead and start. Arti and I are going to bounce back and forth in presenting this information so that there's a change of voice and hopefully people will stay interested. But I think there's a lot of interest in this topic anyway. So Mandy, thank you for that wonderful introduction. And we just thought we'd just add a little bit more detail of what we're going to cover today in our webinar. So we're going to give you a little bit of background about the Prevention Works in Seattle Coalition and the Washington Poison Center. And then we really want to spend a considerable amount of time talking about nicotine and the different forms that it comes in, cannabis, and a little bit on alcohol. We want to back that up with some of the research and the trends with the data that we currently have. And thank you, Mandy, for sharing the current healthy use survey data about e-cigarettes. And we'll touch on some prevention programs and strategies in Washington and some tools and resources. So we will be using the terms e-cigarettes and e-cigs and JUULs and vapes and vapor products interchangeably. So wanted to make sure that that information was out there first. Consistently through our slides, we tend to use the word e-cigarettes just to keep that consistency, but know that in the conversation we're covering several things. So quickly about Prevention Wins, and the reason that that we share this information is because of the question of why is Prevention Wins Coalition and the Washington Poison Center presenting this webinar. Why has this been a strategy and a high-level activity for both of our organizations? Well, Prevention Wins is a coalition that is currently funded by a Drug-Free Communities grant, and it's housed at Seattle Children's Hospital in Adolescent Medicine, and has been around for about 14 years and really serves Northeast Seattle based on our zip code requirements from the Drug-Free Communities grant. We've always been focused on underage drinking, on nicotine, marijuana, and prescription and over-the-counter drug use and abuse with kids. And so as a coalition, of course, we've got a variety of partners, and there are 4 specific Seattle Public Schools in our community, the Washington Poison Center, UW, law enforcement, a variety of parents, and a variety of other media and healthcare providers. But I'm going to circle right back to the Washington Poison Center. So the Washington Poison Center is physically located in Northeast Seattle, though serves the whole state of Washington. And so when I came on board as the coalition coordinator for Prevention Wins and had discovered that Seattle Children's and the Poison Center have always had a partnership, we made sure to really dig in there to be sure that the Poison Center was a specific part of our coalition. And when in doing that, 4 years ago, the Poison Center specifically called out some data numbers to the 2 Prevention Wins of concern, and one of them being about e-cigarette use, and particularly about accidental ingestion and overdoses of very young children, toddlers, of the e-juice, of the liquid nicotine. And the Poison Center, being as fantastic as they are, said, how do we get out in front of this to try to prevent this? And that is what launched this great partnership of developing the e-cigs training of trainers, finding the truth among the vapors. So today's webinar is based on that 3.5-hour training that Arti and I and many other people now provide across the state. And so we've taken a chunk of that information to be able to share today. And so I feel very fortunate to be able to work with the Poison Center to be able to share this information. So go ahead and advance to the next slide, and Arti, over to you.
Wonderful. Well, my name is Arti, and I work at the Washington Poison Center. And the Poison Center has been alive and going for about 63 years. Our call center staff, whenever someone calls into the national toll-free number, it's staffed by nurses and pharmacists who have a specific specialty in poison information, and we like to call them SPIs, specialists in poison information. So they get to go digging, understanding what individuals are exposed to and how to give the proper medical management and care. On average, we receive about 63,000 calls a year, about 200 a day. So we're very, very busy in our call center, and we get calls about emergencies as well as for information calls as well, for questions. There's a public health educator on the eastern side as well, who's housed at the Spokane Regional Health District, who is my counterpart, and we get to tackle the whole state and go out and do outreach and presentations and training all around the state. Last year, we reached about 56,000 individuals and did many different trainings and presentations all around the state. And if you look at the right-hand side, you'll see Mr. Yuck's mascot is there, and people may wonder or may say out loud, oh, there's Mr. Yuck. He's still alive, and he never went away. We just lost funding for a little bit, and he's back in action and ready to go all around the state. So we're going to delve into vapor products or e-cigarettes. The federal level agency terms e-cigarettes as ENDS, E-N-D-S, and it stands for Electronic Nicotine Delivery System, and it's defined as the battery-operated device that vaporizes a substance for inhalation. And for us today, we're not going to use the term ENDS. You don't really hear individuals saying, I'm going to go outside and use my ENDS, or I'm going to go over there and use my ENDS. They usually say vape product or e-cig or mod or JUUL. And so those are the terminologies that we're going to be using interchangeably. And we're going to be talking about both nicotine as well as cannabis vapor products. Now, there are three main parts to a vapor product. There is your battery, and then there's your atomizer, where is also your heating element is. And there's a liquid reservoir for your e-liquid nicotine, where the liquid nicotine aerosolizes and goes out of the mouthpiece. And the e-liquids come in various different types of bottles. The one on the right, lower hand side, you'll see it says seedless watermelon or e-juice. Those are some examples of what e-liquid nicotine comes in. There's also larger bottles that will come in as well. Now we're going to go through various different types of vapor products. It's a very fast market, and it evolves very, very quickly. The most basic type of vapor product that we have seen on the market, and the first one was your minis or your cig lights, and that specific vapor product is on your top left-hand corner. It looks very much like a combustible cigarette. Another example is on the bottom left-hand corner. There's a top one's Enjoy, and the bottom left one is called your Blue. Now these are your disposable vapor products, where you use it until all the e-liquid is completely done, and then you toss it away. And they come in various different strengths, various different flavors, like your cherry crush or your vivid vanilla, your tobacco or mint glacier. It comes in various products. And these are disposable. You don't recharge them, you don't refill them, you're done after you use them. Your second type is your mid-size rechargeable vape pen. And that specific one looks like it's on the top row, and in the second, there you go, thank you, Andy. It's that specific vape pen right there. And this one has one heating element. You can put liquid nicotine inside of the vape pen, and the nicotine could be various different strengths and various different flavors as well. And this is rechargeable. So once you fill it up once, you can recharge it, you can refill it, and you can vape any time of day and continue doing so. You don't have to toss it away after. You may even see one of these vape pens kind of hung as a lanyard around someone's neck as well, kind of like a necklace. And this is different from the vape pen to the right of that. The one that I just spoke of had one heating element, and that one right there that's being circled has 3 different heating elements. That is something called your MOD, or your Advanced Personal Vaporizer. This one in particular has 3 heating elements, and if you've ever seen anybody use a vapor product and you see these big clouds that are producing from their mouths, or you see them in the car or on the street, they're using one of these. Now this one has 3 heating elements, which helps create these large clouds in the air, and it you can also, similar to the mid-size rechargeable vape pen, fill up with any sort of vape liquid, various different flavors, various different strengths, etc. Now, the ones that I just talked about all are filled with free base nicotine, and this is one of your most basic types of nicotine. Now, what we're going to be transitioning into is nicotine salt-based formula, which is a much stronger concentration of nicotine. And these products that I'm about to talk about also stays in your bloodstream. The nicotine stays in your bloodstream for a longer period of time because of that nicotine salt-based formulation. So the first one that I'm going to be talking about is your JUUL. And you may have seen this before, I've heard of it before on the news. It looks very much similar to a USB drive. And it's the one that's on the bottom, middle hand where the arrow's being circled around. Now the JUUL comes with various different pods, and the pods have, all of them have nicotine, and there's various different flavors as well that you can also get with this specific nicotine vapor product. And this one has the salt-based formulation. It's very sleek, easy to use, and it's very much, it's more familiar to our middle schoolers, high schoolers, and youth population. And this specific vapor product, you don't necessarily refill it. You can reuse another pod, but you don't open up the pod and refill it. Not to say, though, that there are videos online on how to open up the pod and refill it using various different tools and filling it up with nicotine salt-based formulation. However, it's not designed to do so. Your next iteration of salt-based vapor products is your store and drop or your smock badge, and those are the 2 on the right-hand side. The one on the top is a store and drop, and the one on the bottom, a smock badge. Now this one also has a nicotine salt-based formulation, and it is refillable. It's designed to be refillable. It's rechargeable as well, and if you hold it in your hand, it actually fits in the palm of your hand. It's very sleek and small and easy to conceal as well. Now, one of the first kind of concerns that we have is the mods in particular hold lithium-ion batteries. And what we know about lithium-ion batteries is that the batteries, when they get to a certain boiling point, there's a flammable electrolyte, and when it heats up to a certain area, it bursts, and it causes the battery to explode and catch fire. And so there are many different stories of individuals having their e-cigarettes explode in their mouths, their pockets, their purses, and this is one of the concerns that we have is the burns that are caused by these different products. We've also seen, yeah?
This is Mandy. I just wanted to draw our viewers' attention to this image down here. Can you tell us what's happening?
Yeah, the individual went into the convenience store and he was paying for his product that he was buying, and his e-cigarette was in his pocket, and it all of a sudden blew up, and it was in his pocket. He like ran outside right after, but he had third-degree burns. And on the top it says an exploding vape pen caused Florida man death, and so that we actually saw one reported death of a vapor product exploding and catching fire. Now, there are 4 main ingredients in vapor product liquids, and this is one of our biggest concerns. We felt it wasn't adequate if we just talked about the vape liquid. We needed to also talk about the explosiveness of the batteries as well. But this is one of our biggest concerns, is the actual liquid. The 4 main ingredients are your nicotine, which acts as a stimulant in certain doses, and acts as a depressant in other doses and higher doses. Nicotine, at the Poison Center, we categorize it if someone calls in and there's mild or moderate symptoms. That means they're having an upset stomach, nausea, vomiting, headaches, heart rate increase, high blood pressure. But when we consider a severe case, severe symptoms, those are categorized as seizures and confusion, being weak, low blood pressure, and muscle paralysis. Now, the other 2 ingredients are more for shelf life, and the propylene glycol and vegetable glycerin. And then flavoring is another ingredient, and flavoring isn't just one specific ingredient, multiple different chemicals that are made up of flavoring. Now, this is a graph that we created to help you understand the different sorts of doses that you can get for various different liquids and how much it costs. So if you look at cigarettes, it's about 47 cents per dose. And so you get 20 doses in a cigarette, so it's 47 cents each. For a low dose e-juice, it's about 16 cents. Higher doses, it gets to be cheaper and cheaper. So if you look on your right-hand side, you'll see your salt-based e-juice, it's about a cent, and you get that many doses. It's much more cost-effective to have a nicotine salt-based formula that's a high concentration, and it's much, much cheaper. And it's interesting because vapor products aren't necessarily priced based off of the nicotine content and strength.
Hey, Arti, this is Mandy again. Something that I have heard in the field, and you can pause me and say, oh, we'll talk more about that later, but I know that there's really high nicotine content. So I'm seeing lower prices for more doses, and that maybe the toxicity is higher. Am I reading that right?
That's a great question. If you flip to the next slide, I'll definitely talk about that more. Awesome, thank you. Now, talking about the strength of the doses and what the toxicity looks like. So for incombustible cigarettes, there are 20 cigarettes in a pack. And each cigarette has about 12 milligrams of nicotine. But once you actually use the nicotine, it says it's about 1 to 2 milligrams that you actually intake. At a low dose e-cigarette, let's say it's about 6 milligrams of strength. And if it's in a 15 milliliter bottle, and that's your average bottle size, the whole bottle would have about 90 milligrams of nicotine. Now let's talk about a high dose e-cigarette liquid. 36 is a higher dose that we were finding in our stores. And if you look at how much of nicotine would be in the whole bottle, it's 540 milligrams. And what we found at the Poison Center, I asked our specialists, is what what is a lethal dose? And their response was 1 teaspoon of a 36 milligram strength bottle is a lethal dose for a 20-pound baby. A couple of teaspoons, 1 teaspoon in a 36 milligram strength bottle. Now, I want to kind of help you understand what JUUL looks like as well, because you see that a lot more often, and you hear it on the news as well, and you want to understand what's the difference. So JUUL is very smart in its ways, and their cartridge is actually smaller. It's about 0.7 milliliters per pod. And the actual strength of the JUUL is 59 milligrams. So the pod is very small. And I want you to imagine taking a 15 milliliter bottle and filling up that bottle with the JUUL salt-based nicotine liquid. I want you to imagine filling it up to 15 milliliters. If you filled it up, the whole bottle would have about 885 milligrams of nicotine in that bottle of JUUL liquid. That's about 59 milligrams per milliliter. Now, salt-based liquid, there's a 70 milligram as well. The strength, as you can see, they're getting higher and higher as vapor product industry evolves. A 70 milligram bottle would have about 1,050 milligrams of nicotine. Now, what we're seeing in terms of the marketing and advertising side, nearly 7 out of 10 U.S. middle and high schoolers report exposure to a vapor product from at least a television, a magazine, YouTube, from a retail store. And this is a 2014 number. I would suggest that it would be much higher now. I would even suggest if it was 8 or 9. All right, this is my turn to transition over to Liz.
Great, thanks, Arti. What do we know from research about e-cigs and vapes at this point? Next slide. So one of the issues that we hear, and I bet that everybody who's on this particular webinar has probably heard this in some way, that e-cigs are less harmful and safer than combustible cigarettes. Or even a comment from somebody who would say, well, at least I'm using a vape and I'm not using a traditional cigarette, so it must be safer. So what we know with a little bit of research that we have, and there's a lot of research that is evolving right now, that typically, yes, cigarettes have a whole lot more chemicals than vapes do. So at least 7,000 chemicals have been identified in cigarette smoke. So vaping probably is less harmful than smoking combustible cigarettes. But we need to keep in mind that the information in the research then says that safer doesn't equal safe. That particular discussion is still in the works for a lot of the research that's going on to be able to show what all types of damage and exposure that we have in using vapes. So less harmful and safer. So why can't we say safe? Because we know that there are metals, heavy metals, that leak from the heating coils, and that they are added into the vapor as a person uses the device. And so you can see that we've identified lead and chromium, nickel, and manganese as part of the vapor that is coming out of the device. So it's not just water vapor. We also know then that that over time the inhalation of these metals really does cause damage, and we have seen that lead to cancer when we talk about all the research that we have over the decades about combustible cigarettes. So we can make that linkage to these metals being inhaled and contributing to lung, liver damage and cancer to various types of damages to the immune system, the cardiovascular system, and to brain, and inhibiting brain development. So less harmful and safer. But again, why can't we say safe? Well, we've got some more information, again, looking at what we have known about combustible cigarettes. So we know from looking at the aerosols from vape products that they contain some of the same things that we see from combustible cigarettes. Of course, nicotine. We see that there is a formaldehyde that is released in the process when we're talking about a higher voltage. And Arti is going to tell us a little bit more about the different heating methods with e-cigarettes and JUULs and other devices. So those chemicals have been connected to cancer. Free radicals, we know that free radicals cause various damage to cell structures, and cell structure damage is a leading contributor to various cancers. And then we've also identified the diacetyl, and that is known as the term popcorn lung. So coating the lungs and causing damage to lungs and the inhalation of air and oxygen exchange. So we're waiting for more research to come out. It's going to take some time, but in the meantime, you know, we're developing the various damages in the use of vapor products. So, so we use that little graph here to say that we know about specific chemicals that are related to e-cigs and specific injuries that occur because of those chemicals. So at some point, there'll be that direct linkage of research that says that. Next slide. So another issue that comes up frequently is that e-cigs and vapes don't cause secondhand harm. So next slide. We don't know that for sure. Again, research being conducted now, and we just go back to the fact that it is not just water vapor that's being released from vape devices. So safe, again, safer doesn't equal safe. We have found measurable levels of these various toxins in secondhand vapor. So we see things like formaldehyde and acetone and a variety of other chemicals that have toxic associations with them. But let's talk about third-hand vapor. So there is some research, and a particular research that was conducted looking at the various pieces of a room where vaping had taken place, and measuring the amount of nicotine residue that was found on those particular elements in the room. So these researchers looked and checked the floors, the walls, windows. They looked at the ceiling and any metal surfaces. They took some residue from the windowsills, and they found that there was indeed nicotine residue in the floors and windows. So we know at an adult level, we have exposure at that third-hand level. But where we're finding it, if we're finding it on floors and windows, we know that our very young children, especially toddlers, there could be exposure there from being on the floor, from reaching up to a windowsill as well.
Hey Liz, this is Mandy. I just wanted to pull people's attention to the graphic you're sharing where it says the residues from nicotine and its breakdown products can recombine and form carcinogens called nitrosamines. How do I say that? And that the conversion to nitrosamines takes place 2 hours after the burning of tobacco has ceased. I didn't know that.
And Arti has more information about this particular research. And Arti, I don't know if you know the exact pronunciation, and if there's anything else you wanted to add here, go ahead and take that time.
Seems like
all right.
All right, moving ahead.
Muting my. I wanted to share that this specific image was taken from a tobacco kind of finding, and we wanted to share, like, these are some of the findings that we see from tobacco smoke and what the potential it could be for vapor products as well.
Thank you. So the next issue, so this is this relates to what Arti was talking about earlier in regards to how much nicotine is in our e-juice products. And so we've heard several times from kids that they really believe that there isn't any nicotine in the products that they're using, and that they specifically feel that they have chosen various e-juices because of the flavor and the coloring, and that that what they understand is that there isn't any nicotine in there. Well, we have a painful surprise around that. So there was a study that was conducted recently where researchers did test 35 different e-liquid samples, and all of them had labeled that they had 0 milligrams per milliliter of nicotine, and over 90% of those samples actually contained nicotine. 6 of those samples from 2 different manufacturers, and again, they were labeled as 0 milligrams per milliliter, they actually also contained nicotine in amounts ranging from over 5% to 23.9 milligrams per milliliter. So it's true, when we look at the 2017 Monitoring the Future study, so being able to take a national picture, that our teens and young people really believe that they are really just vaporizing flavors, and at least we do have this research to show that that's just not the case. There really is nicotine in these e-juices. And so look at what our 10th graders nationally are saying. They really thought it was just flavoring, and that was the reason why they were vaping, and that was the reason why they felt that it was safer and that it wouldn't be a problem. Next slide.
Liz,
And
what you're saying.
I'd like to also,
Go ahead, Arti.
I just would also like to include another piece of data. The 2017 Tobacco Control Research Study found that 25% of 15 to 24-year-olds recognized JUUL in a photo, but majority of those individuals, about 81%, didn't know that it always contains nicotine.
That was an interesting point that I heard earlier in our webinar, was that nicotine, or that the JUUL pods always contain nicotine.
So Arti, I'll go ahead and hand it over to you at this point.
Also, this is Mandy. I wanted to note that we're seeing some questions come in, and that we are monitoring those questions in the chat log. And we just got asked, is it true that all JUUL pods contain nicotine?
Yes, all JUUL pods do contain nicotine. There are no JUUL pods that do not contain nicotine.
Thank you.
So the fourth issue is we may hear e-cigarettes can be used as a smoking cessation method. People may ask, like, why are you preventing someone why are you preventing something that helps people quit? Well, first off, that's not, FDA has not actually approved vapor products as a cessation method. It has not been approved by the FDA as a legitimate smoking cessation device. Some adults may use this product to quit combustible cigarettes and transition into vapor products, but most likely our young adults are not actually initiating vapor product use to quit combustible cigarettes. What we're actually finding is youth are using e-cigarettes for social reasons, and it's actually even though it's, even if they haven't tried combustible cigarettes, when someone uses e-cigarettes, it's actually, individuals are more likely, whether it's 3 times more likely, 5 times more likely, 8 times more likely, to use future combustible cigarettes. Youth are more likely to use future combustible cigarettes if they use a vapor product, even if they've never used a combustible cigarette in the past before.
And what's interesting also is that the UW right now is conducting research and has evidence to show that e-cigarettes, vapes, JUULs are all being labeled now as truly gateway drugs to our young population, starting with combustible cigarettes. So that research is just being released right now in our own backyard. So we'll be able to incorporate even more sound science behind that really important piece about starting with e-cigarettes as a young person and moving on to combustible cigarettes.
And if you look at this graph in front of us, this is the Healthy Youth Survey for various different grades, and it's the most recent one, and it looks at it over time. So if you look at 10th graders in particular, last year, the past 30-day use was 13%. And this year, our data shows that past 30-day use has increased to 21%. So 1 in 5 10th graders have used a vapor product in the past 30 days. If you look at it from the 12th grade level, in 2016 it was 20%, and this year's data shows that about 30% of students in the 12th grade have used vapor products in the past 30 days. Now, if you look at our Washington Poison Center data, majority of the blue bars, it's all 0 through 5-year-olds, it's pediatric exposures. You can see that there's an increase in trend in 2014 and 2015 and slightly decreased. But all of the exposures that we see at the Poison Center are pediatric exposures. Now, we don't really know why exactly individuals of 0 through 5-year-olds have why the trend is increasing or decreasing. One thing we do know is the vapor product e-juice or bottle at one point was not child resistant, and kids were getting into it, and they were leaking. It was leaking in their mouths, on their skin, and babies' hands are porous, and that could be very toxic to them. I also want to note that all the exposures in Washington State are not reported to us, and we don't receive every single case and every hospital exposure. This is only the calls that we get at the Poison Center through our national toll-free number. Now, transitioning into cannabis, there's another way of vaporizing something, and that's cannabis, vaporizing another substance. And cannabis became legal just a few years ago. And if you would switch forward to the next slide, I'll go into that, why individuals vaporize cannabis can get high faster. There's limited odor to the actual vapor products. And there's this perception of how it's healthier than smoking. There's this term also used as self-vaping that we know of. And it's easy to hide, you don't smell it at all, and there's this perception that it's healthier. Now, if you look at the Washington retail market, there are various different types of products out there. On the right-hand side, you see JUUL joints. That's a very similar product to our nicotine types of products where you use it once and you toss it away, similar to Blue or Enjoy. This one, you also use it and toss it away after you're done, and it has cannabis inside of it. And you can only purchase cannabis products in retail stores in Washington State, cannabis retail stores. On the left-hand side, you'll see a mid-size rechargeable pen for a cannabis product. the one on the left-hand side, you'll see that the top is a mouthpiece. The middle area is where you can open it up and put various different products, butane hash oil or CO2 oil or plant material inside. And if you press the button, you can take a hit from the mouthpiece. And this is rechargeable, reusable, and whatnot. And then if you look at the one next to that, that is called your PAX 3, and you can purchase this, and comes with various different modifiers, and you can have one vape product and vaporize multiple different formulations of cannabis, and that could be dry herbs, so your plant material. It could be butane hash oil or wax or shatter, and it can be CO2 oil as well. The next image that you see is a vape pen, so it's cartridges that you can use for CO2 oil and vaporizing CO2 oil. And this is also reusable, rechargeable, comes in cartridge form. The next one on the right-hand side, you will see a Grenco G pen, and that is specifically to vaporize dry herb or plant material. And this image right here just shows exactly that you can, on the bottom, you'll see the similar batteries, and you can purchase different modifiers in the middle to vaporize various different products, various different formulations of cannabis, whether it's dry herb, waxes, concentrates, or CO2 oil. And you can switch the mouthpiece as well to vaporize that specific product.
Hey, Arti, this is Mandy.
Yeah.
When I'm listening to you present on these different devices, I'm also noting some of the things I've heard out in everyday experience. There seems to be almost a subculture around like modding devices, or that it's like a lifestyle for some youth and young adults.
Are you asking if it's like a culture, or if it's like a identity that they form?
Yeah, I am.
Okay, so to some, it is an identity. It is part of their own culture and part of their own lifestyle. And to some, it's merely for social reasons of use. There are various different kind of reasons for use. For cannabis, there's a finding that's also for treating kind of or medically, really helping for medical reasons that individuals use. And we have some data that I'll show you in a second. It's in the slide while individuals use cannabis for in King County specifically. If you forward to the next slide, I'll show you that. Now there's different forms of vaporizing cannabis. What I'm about to talk about is different. It's not vaporizing cannabis. It's not vaping at all. It's a completely different form of taking in cannabis. So this is called dabbing, and what you do is you heat up an area on this bong on steroids to 900 degrees with a blowtorch. You take a scoop or take a dab of butane hash oil, and then you press it down this area where it's black on, and she's pushing it down. It flash vaporizes. And it goes into the mouthpiece, and there's different water reservoirs to cool it off. This is called dabbing, and it's a completely different form of taking in cannabis. It's even what I've heard, and this is just anecdotal stories, is especially to individuals who frequently use cannabis and long-term users of cannabis, is you get an experience, a high that is sometimes it's really quick and really fast. And I've heard frequent users don't appreciate using or don't like using this. That's not hard data. It's just individuals I've talked with and have heard from. There's also a portable dab rig as well that you can purchase, so you don't have to carry your blowtorch and carry all the different devices that you need to dab. And this specific image is from a cannabis website, and so it says right there, heats up to 600 degrees Fahrenheit, so not as high as doing it yourself. And it also says, do not heat the device more than 3 cycles continuously to avoid bodily harm and injury. Now, I hope everybody reads the caution labels. I don't always do so, and I don't know if everyone does as well. So,
Sorry, go ahead.
In JAMA, in late 2018, there was a study that was published that showed that 1 in 11 teenage students used a marijuana product, used marijuana in a vapor product. Now, these are just images of what our retail stores look like. There's all sorts of types of products out there. There's edibles that look very similar to regular drinks that we see. There's sriracha, there's cookies, there's joints, there's a dab rig. If you click to the next slide, you'll see various different edibles that you see as well. And if you look at it, there's the Not for Kids sticker that we put on all the edibles. And this was actually first in 2017, where all of the edibles they have to be on all the edibles have to have a Not for Kids sticker on there to help communicate that it's a vapor product and that it's not for kids, and if something does happen, to call the Poison Center. And if you look at it, there's all sorts of products. There's sriracha sauce, there is drinks, there's mints, marmas, milk truffles, brownies, etc. Looks very much like the food that we see around grocery stores. This is Washington Poison Center data. Exposures have been increasing since 2012, and that's when I-502 passed and shops opened up in 2014. Now, we don't really know why exactly our trend is increasing, because we don't know if people feel more comfortable calling the Poison Center because cannabis is legal, or if our number is more available because it's on the Not for Kids sticker and that's edible packaging, or if there's more access, or if there's truly more exposures to the Poison Center exposures occurring. So we don't know why this number is increasing, but we see that it is. And if you click to the next slide, you'll see that it's across the board. It's increasing in many different categories, especially our 0 through 5-year-olds. There's a significant increase in our pediatric exposures where they're getting access to this and exploring, and children explore with their mouth. And so caregivers and parents are calling the Poison Center because they either found their loved ones exposed to this and need some support, or want assistance on what to do. And our Poison Center data is going to be released really soon, so you'll see what's happening. I won't share it with you quite yet about what the trend looks like. And I'll let Liz take it over from here.
Thanks, Arti. Okay, next slide. So we wanted to share a little bit of specifically what we were doing in King County, because we think that this is probably reflective across the state. So the King County Youth Marijuana and Education Program, which I believe we've got that type of programming and funding from the Department of Health across the state. In King County, we conducted some listening sessions with youth over the past couple of years. And what we heard over and over again from our youth, and about the average age was about 15 and a half of the youth who responded, is that their youth, they say they do it because their friends are using it. They've heard that a lot of people are getting sucked into vaping, and particularly vaping marijuana, because they're at a social gathering, and others that they trust are doing that, are engaging in that type of behavior. So we know that that's kind of that passive peer pressure everybody else is doing it, so I think I should too, type of response. And over again, this whole statement about, well, vaping must not be, it must not be dangerous, or it must not be as harmful as, again, as combustible cigarettes. So, and you know, and if it's 0% of nicotine, then it must be pretty harmless. Well, we have a challenge with labeling, and it's not just the labeling of our edible marijuana products, but it really is the labeling of our e-liquid products. There hasn't been a great standardization and regulation around how these products are labeled in terms of the amount of nicotine in them. So, so it could be very easy for somebody to misidentify and think that that a product that they have does not have a whole lot of nicotine in it, or may indicate that it has zero amount of nicotine. But as we had demonstrated earlier in the webinar, that some research was conducted and showed over and over again that there was at least some level of nicotine, even in those that labeled it at zero. So, so it's really has been very interesting to be able to listen to our youth and hear them say these statements that I think we've heard over the decades about why kids use, and that, you know, using a JUUL looks pretty cool, and it's really easy to disguise. When it looks like a flash drive, when it can be recharged on a laptop, boy, that looks sleek. Boy, that looks really easy, and so many adults just don't see that. So our next slide. So Arti, I'm going to pass this one back to you.
So for this specific graph, this is the Healthy Youth Survey in the past 30 days. And what we're noticing is that as students go up in grades, the percentage of students within that grade that who use current past 30-day marijuana use is going up. So the percent of students as they're getting older within their grade levels, their past 30-day use is increasing.
So I'll jump back in here. This is Liz. So we just listed some of the concerns that that we see, some of the implications for our prevention and intervention work when it comes to vapes and e-cigarettes, and specifically when we are talking about cannabis. We know that today's cannabis, today's marijuana is a very different product from what we used to have available 10, 20, and more years ago. The potency is much stronger. The THC concentrations are very high, especially when we're looking at edibles and looking at concentrates. We can see up to easily as high as 60-some%, and some products even higher of THC. We know that heating vapor devices and those coils to really high temperatures, that there is those release of metals, of formaldehyde, of other chemicals that are connected to cellular damage and cancer. And are concerned about dependence. So 1 in 11 who use cannabis develop some type of cannabis dependence disorder. It's on the rise. We frequently hear from treatment centers and treatment admissions for adolescents that they may be coming in for another reason, but they may cite when they come in the door that it is a marijuana dependence. And one of our other concerns is how often withdrawal is misidentified. When we hear that heavy users, especially young people and our young adults, who talk about anxiety and that they need to use marijuana and cannabis on a regular basis to keep their anxiety in check. And many times that's just a misidentification of withdrawal, that anxiety is a withdrawal symptom. So keeping that dependence going by misidentifying and self-medicating with cannabis to be able to take care of mental health issues. Next slide, please. So I'm thinking that this particular slide and this piece of the webinar is something that's familiar to probably everybody, again, who is part of the webinar today. And we know that we have concerns for our youth because of adolescent brain development continuing into what has been documented now to at least around the age of 25. And so cannabis really, that regular use really does affect the system that is developing for the brain and actually can create pathways for dependence. And that might not be something, it might not be a cannabis dependence that continues, but some other drug dependence. We also know that the perception of harm from cannabis use with our youth continues to drop, that as long as we keep equating it with medicine and the amount of advertising and promotion of legal marijuana, that impacts what our young people believe in terms of risk. So we do see a bit more now of adolescents who equate marijuana with medicine. Next slide. So a little bit about alcohol, because we did want to make sure that we covered the specific drugs right now that our adolescents are most interested in. So as we have seen this huge increase in vape use, JUUL use with our adolescents, alcohol still is the most widely used substance among our adolescents and our young adults. So we have researched over the years to see that the average age of our young people having their first drink is 14. We know that there is a relationship between a child and a parent who binge drinks, that normalizes the behavior, and that those youth are more likely to also binge drink later in life. I think that piece that Arti was talking about earlier, that our kids between 11 and 14 see a whole lot of alcohol ads, whether that is online, whether that's billboards, other print materials. So over 1,000 alcohol ads a year, that's a lot. Next slide, please. So just reiterating that the teen brain really is very vulnerable to alcohol and developing those pathways to rewards for consuming the substance. And mixing alcohol and marijuana, we've found it to be a dangerous combination, really impacting judgment. And our partners with the Washington Traffic Safety Commission have quite a bit of research over the past year and a half looking at bringing marijuana on board with other substances and driving, and with our young people as well as our adults. We know that mixing alcohol and prescription medication is dangerous at any level, regardless of age. And I think one of the things that is something that our adolescents don't always look at is those consequences of consumption and overconsumption, particularly with alcohol, and a variety of ill effects, that some which are just annoying, such as headaches, to those that are far more dangerous, such as internal bleeding and heart problems. Next slide. So we just wanted to highlight just a couple of the prevention strategies that we see in Washington State related to our young people and trying to create healthier opportunities for them. Next slide, please. So a list that we usually talk about here, many times when Arti and I present with parents, we thought that this might be something that could be useful to those of you on the webinar in the type of work that you do, whether it's directly with youth or it's with adults that have influences over young people. So one of the things that's really important is for us to understand what the laws are regarding cannabis, around alcohol and other drugs, and what that means for adults and what that means for youth, and how those laws are different. It's really important to consider how important norms and perceptions are, and we know that risk factors that talk about availability of various substances also equals what is the perception of the availability. So perceptions are extremely important and very powerful with our kids, and norming is as well. As we learned, particularly during our King County listening session with kids saying that other kids were doing these things, were vaping, so that the norm is set there. We talk with parents and make sure that they are familiar with what their own mental health and behavioral health issues are within their family, what those risk factors are that are family related, and to have those conversations with their kids. We hope that most parents and other adults that work with kids acknowledge the role of impulse control and the development of that in our adolescents. And then we shouldn't overlook the fact that there is a strong influence of pop culture on what our kids use, and vapes and JUULs and cannabis use are definitely susceptible to that. So, so keeping that in mind. And then the other pieces that our youth have said of why they use, boredom and lack of confidence, an opportunity to be able to escape. And there are recordings of youth who talk about self-medicating using particularly cannabis. So the other most important part is for us to correct any misinformation with our young adults and our kids to make sure that they have accurate information about these substances. Next slide, please. So again, calling out what parents can do to help really prevent youth use. So we know that parents are the first line of defense. They really are the first line of prevention. So expressing a no-use attitude and doing that in a way that helps a young person to be able to have that conversation about why it's a no-use message that's being expressed by the parent. We ask parents to not make substances available to their teens or their teens' friends. We know that there is research from the Social Development Research Group at the UW that has talked about the opposite effect when parents actually use a norm of indicating that they want to teach their kids how to drink at home in what they consider a safe place. That tends to backfire and is a boomerang effect of leading to more problems when kids are launched out of the home into college or on their own, that actually creates far more of a problem than it creates a safety. So helping our kids to be able to practice feeling comfortable in saying no and really being those big shoulders so that those kids can go ahead and point back and say that their parents would really be upset with them, or whatever language works there, as a way to escape being in that situation of having to make a choice about using or not. And so we remind all parents to keep track of your teens, know who they're hanging out with, get to know the parents of your teens' friends, keep those lines of communication open, make sure to set those guidelines and stick to them, but also to grow those boundaries with our kids that at one age, they may be very effective, but those boundaries also need to grow as the child does and as they demonstrate their ability to be responsible and make healthier decisions. Next slide, please. So Arti and I listed some of our favorite parent resources here. So they're mostly websites, and so with Prevention Wins, we do have a Parent's Guide to Preventing Underage Marijuana Use. That booklet is available online and in hard copy. It's available in a variety of different languages as well, and it's though it is specific to marijuana, it has many of the tips and tools in it that could be used by parents as well as other adults, regardless of what the drug is. And as you can see, we've listed the Washington Poison Center and the Start Talking Now website, which is a website hosted by a collaboration of state agencies, providing quite a bit of information, again, for parents, adults, and community members. And maybe some of you are familiar with the You Can campaign in our state that the Department of Health launched last year. And I'd also suggest the Alcohol Drug Abuse Institute at the University of Washington and the Clearinghouse, NIDA, the National Institute on Drug Abuse, and then a couple of specific King County resources here that I think have reach across the state. King County Public Health put together a short video animation called Escape the Vape. It's just a couple minutes long. It's geared toward youth, talking about, well, it's the animation of several of the chemicals that we talked about today that would show up in vapor. And those chemicals are talking to each other about their roles. So I think it's a great opportunity to be able to educate kids. And then we also listed Take Back Your Meds. So not to leave out the fact that prescription and over-the-counter medications continue to be a significant issue in our state at both the adolescent and young adult age, but also with adults. So we wanted to make sure that we listed that resource. So I think that brings us probably to the end of our scripted webinar at this point. So Mandy, I guess I will hand it over to you in terms of questions.
Thank you so much, Liz and Arti. We have been monitoring the chat box, and we've had a couple of questions come in. And through your presentation, I think that most of them have been answered. We had additional questions about, do all JUULs contain nicotine, or all JUUL pods? So just to confirm that, yes, all JUUL pods do contain nicotine. Are we right?
Yes, that's correct.
Also, we had some clarifying questions about students who might be purchasing flavor only or zero nicotine e-juice. They think that it might just be flavor pods, but it's very likely that they're actually vaping nicotine. Is that also correct?
We don't know. That could be definitely potentially a concern after the research findings that we saw, that even though the label would say 0 milligrams per milliliter, there is potential for nicotine to be inside of it as well, according to that research finding.
Thank you. Another question we had was about the price of JUULs and vapor devices compared to buying cigarettes, or the taxes. I'm sorry. Do we know if the taxes will be applied?
The vapor product tax. Sorry, Liz, would you like to answer this? I didn't mean to just jump in.
Thank you. We did just pass, the legislature did just pass a vape tax bill, and I'm not sure when it comes into effect. I don't believe it has started yet. So there is a comparison that shows what the percentage of tax will be on each of the products. And I would reference, I'm going to call out a great resource, which is Scott Neal from the King County Public Health. He was able to look at what the relationship is between the amount of nicotine in the vapor devices and the percentage of tax. So it is, it seems to me like it's a little bit more complex, so I'm not the best person to be able to give you that information. And I would point to Scott for that. There's going to be more information rolling out about that because it is a new tax that I believe does start this year, but hasn't started yet. So I'm sorry that I don't have more detailed information about that.
No, I think one of the issues with having a webinar on this topic matter, there are so many, it's the seed ground for so many other questions.
And for combustible cigarettes, if you don't mind if I just speak on that, it's about 98% for a pack of cigarettes. So it's about, on average, like $10, $9 for a pack of cigarettes.
Thank you. We have some additional questions. One question we have right now is, are we able to provide any model policies that schools can implement for students that use or possess nicotine or marijuana or vape devices? And this is Mandy here at OSPI, so I'm going to go ahead and field that question first. You know, it's a really big topic in schools, especially because this year we have some rule changes related to school discipline and student discipline. So it doesn't have a quick, easy answer. There are some policies, and for model policies for schools to look at, they might be referred to WaOSPI. I would also say that we have a one-pager on the rule changes and how they are related to substance abuse on our website. So that's another resource you can access. We would also refer folks to the behavior menu of best practice for more information on what works for behavior, because oftentimes substance use or substance possession in schools is seen as a discipline issue, but it's also a health issue. So we're really looking at ways to open up the perception for how adolescent substance use is both a health issue in addition to a discipline issue. Another question we had was, how can we assess for cannabis use in young children and older students? So Liz and Arti, we responded that one way to assess is to do a screening and or in a medical setting that actual tests or medical tests could be run. But the follow-up question to that was, in school settings that have a nurse, counselor, and intervention specialist on site, is specialized training required for screenings? And I think that would get back to the protocol and procedures that are in place at your district level. So I also want to differentiate for the folks out there interested in screeners, that the word screening and the word assessment can mean different things in different settings, and that we would be really careful about that, because in some settings an assessment is a clinical tool, or screening can be thought of as a clinical tool, but there are also screeners that are not clinical or diagnostic in nature. So those questions I think have a little bit more nuance than we'll be able to answer on this webinar.
There was also a question, this is Emily from WaOSPI, question about the Escape the Vape and the email or the URL for that, and I believe it's escapethevape.org. Arti or Liz, can you verify that for me? It's a great
That's correct.
It's .org. Yep. Okay. Thank you.
One more question. Can we include these resources that we just mentioned in the email? Yes, we can. I'll make sure that the school discipline one-pager and the behavior menu best practice both get sent out.
And there's also another question about resources in general about vaping and such. On the OSPI website, there is a link of resources on one of our pages, and we will send you that out as well.
Yep. All right, so I'm looking at the time. It's 2:22, which gives us just a few last minutes. If you have any additional questions, we'll give that about 30 seconds and we'll monitor. So Liz and Arti, we're seeing some folks asking for some really specific resources. We will send out the slides so you can look at the resources that Arti and Liz listed here as one list of resources, but in our follow-up email we'll also be able to link to some of the things that were discussed in the last few minutes. I wanted to say a really big thank you to our presenters today for making the time not only to put this slideshow together, but also take the time to do such a thorough presentation. So you can expect from OSPI some follow-up emails. And one last check-in with our presenters, Arti and Liz. Any last comments?
Mandy, I'm happy to send you the actual links. I do have just, you know, a Word document and a PDF of links of the resources. And I'm excited to add OSPI onto our favorite parent resources. Thank you for that.
Wonderful. All right, well, this is OSPI with Emily and Mandy. We'll be signing off. We wanted to say thank you so much for joining us today. We had over 100 folks present with us. This will be made live and posted to the OSPI website. For folks who registered, you'll get a link directly notifying you that. So thank you so much for everybody's participation today, and have a great one.
Thank you, Mandy. Thank you, Arti and Emily. This is Liz. I really appreciate
everyone.
this today. Thank you.